My name is Danette, but I go by Dani. I was diagnosed with symptomatic obstructive HCM when I was 53. My doctor called it hokum, and it changed my whole life. I always thought of myself as really a healthy person. I grew up in Southern California, so boogie boarding, rollerblading on the boardwalk. Fitness was always top of mind. The first symptoms were shortness of breath, dizziness, fatigue, near passing out a couple times, and then just progression of those symptoms worsening. And that's what led me to the cardiologist. My obstructive HCM symptoms took a lot from me. Simple things like cleaning the house, doing laundry, running the vacuum, enjoying the grandchildren, being able to get down on the floor and play with them just wasn't happening. I couldn't do it. Not to mention trying to hold down a job. It just takes your life and turns it upside down. I knew I had to do something. When I was diagnosed, I was first prescribed oral medication, but my symptoms were not improving. And then the cardiologist said that my obstruction was so bad, I was going to need open heart surgery, a myectomy. My doctor and I decided to do the surgery to hopefully get some symptom relief. Unfortunately, after a few months, I was still having symptoms, so I went in to get it checked out. And my doctor said, "Your obstruction came back." And I remember thinking, oh my, is this my life now? I felt like I was being robbed of everything. I haven't been able to see my youngest daughter who lives in Denver. It's been like 4.5 years since I've been on a plane. I thought I was done traveling. I thought I would never be able to travel again. The symptoms were making me feel like I was a prisoner in my own life. But I knew there had to be something more that I could do, so I went back to see my doctor. I really had to advocate. By this point, I tried 2 other medications. I even had open heart surgery. My symptoms still weren't improving, so I found a different option. I talked to my doctors and we discussed CAMZYOS. My cardiologist agreed that I was a good candidate. I am so glad that we started this because now I'm going to see my little girl in Denver.
We'll hear the rest of the story in 2 minutes after this important safety information. CAMZYOS, also known as mavacamten, CAMZYOS is a prescription medicine used to treat symptomatic obstructive hypertrophic cardiomyopathy in adults. CAMZYOS may improve your symptoms and your ability to be active. Please see U.S. full prescribing information, including boxed warning and medication guide on CAMZYOS at CAMZYOS.com. Warning: risk of heart failure. CAMZYOS may cause serious side effects, including heart failure. A condition where the heart cannot pump with enough force is a serious condition that can lead to death. You must have echocardiograms before you take your first dose and during your treatment with CAMZYOS to help your healthcare provider understand how your heart is responding to CAMZYOS. People who develop a serious infection or irregular heartbeat have a greater risk of heart failure during treatment with CAMZYOS. Tell your healthcare provider or get medical help right away if you develop new or worsening shortness of breath, chest pain, fatigue, swelling in your legs, a racing sensation in your heart, palpitations, or rapid weight gain. The risk of heart failure is also increased when CAMZYOS is taken with certain other medicines. Tell your healthcare provider about the medicines you take, both prescribed and obtained over the counter, before and during treatment with CAMZYOS. Because of the serious risk of heart failure, CAMZYOS is only available through a restricted program called the CAMZYOS Risk Evaluation and Mitigation Strategy, or REMS program. Before you take CAMZYOS, you must enroll in the CAMZYOS REMS program. Please see important safety information, including boxed warning, for CAMZYOS at CAMZYOS.com.
My symptoms have been improving and things have really changed for the better. Being on this trip means so much. I haven't seen her in so long. Now I can come see her more often and I'm thrilled.
What do you want to do while you're here?
Go to nice restaurants, go shopping.
Maybe go dancing?
Yes, we could try ice skating.
We can try
That may be
skating.
dangerous, but we can give it a shot. Being able to travel, navigate the airport, get on the plane, haul the luggage, that was something I could have never even thought of. So the fact that I know that I can travel, that's a mental change, because you know that you have the ability to go see your family when you want to.
And I see a change in you too. You're just very positive and you're more energetic.
I am able to do more, walk further, get out a little more, but I have to say it's not all rosy and perfect. I did experience dizziness back when I first started, and it's not like CAMZYOS is a cure. I still have obstructive HCM, but I'm lucky. I'm feeling so much better.
Seeing all the improvement that you've made and how far you've come, I'm just really happy.
CAMZYOS has really made a difference for me. To go from not being able to leave the house some days to being able to travel here, I mean, yes, my symptoms are improving, no question, but this, being to be here, is everything.
If you could do anything differently, what would it be?
It would be start CAMZYOS sooner.
And when patients see this story, what are some of the things that you would want them to take away from this?
There is hope. Feeling better is possible. Don't wait to your next appointment. If you're experiencing symptoms, consider calling your cardiologist today and ask if CAMZYOS may be right for you.
Important facts about CAMZYOS, also known as mavacamten. This is a summary of important information that you need to know about CAMZYOS. Your healthcare provider can work with you to help answer any questions you may have about this medication. What is CAMZYOS? CAMZYOS is a prescription medicine used to treat adults with symptomatic obstructive hypertrophic cardiomyopathy, obstructive HCM. CAMZYOS may improve your symptoms and your ability to be active. Warning: risk of heart failure. CAMZYOS may cause serious side effects, including heart failure. Heart failure, a condition where the heart cannot pump with enough force, is a serious condition that can lead to death. You must have echocardiograms before you take your first dose and during your treatment with CAMZYOS to help your healthcare provider understand how your heart is responding to CAMZYOS. Echocardiograms, or echoes, are imaging tests, a type of ultrasound study, which take pictures of your heart and show how well your heart is working. People who develop a serious infection or irregular heartbeat have a greater risk of heart failure during treatment with CAMZYOS. Get medical help right away if you experience new or worsening symptoms, including shortness of breath, chest pain, fatigue, racing heart, palpitations, leg swelling, or rapid weight gain. The risk of heart failure is also increased when CAMZYOS is taken with certain other medications. Tell your healthcare provider about the medicines you take, both prescribed and obtained over the counter, before and during treatment with CAMZYOS. Because of the serious risk of heart failure, CAMZYOS is only available through a restricted program called the CAMZYOS Risk Evaluation and Mitigation Strategy, or REMS program. This means you and your healthcare provider must both be enrolled in the CAMZYOS REMS program in order to have it prescribed. Talk to your healthcare provider about how to enroll and for more information about the program. Your healthcare provider and pharmacist will make sure you understand how to take CAMZYOS safely, which includes returning for echoes when advised by your healthcare provider. You can only get CAMZYOS from a certified pharmacy that is part of the CAMZYOS REMS program. Talk to your healthcare provider about finding a certified pharmacy. You will not be able to get CAMZYOS from a local pharmacy. If you have questions about the CAMZYOS REMS program, ask your healthcare provider or visit CAMZYOSREMS.com or call 1-833-628-7367. What should I discuss with my healthcare provider before starting CAMZYOS? Talk to your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant. CAMZYOS may harm your unborn baby. Tell your healthcare provider right away if you become pregnant or think you're pregnant during treatment with CAMZYOS. You may also report your pregnancy by calling Bristol Myers Squibb at 1-800-721-5072 or by going to bms.com. If you are a female and able to become pregnant, your healthcare provider will do a pregnancy test before you start receiving CAMZYOS. You should use an effective method of birth control, contraception during treatment, and for at least 4 months after your last dose of CAMZYOS. CAMZYOS may reduce how well hormonal birth control works. Talk to your healthcare provider about the use of effective forms of birth control during treatment with CAMZYOS. Talk to your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if CAMZYOS passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with CAMZYOS. What medicines should I discuss with my healthcare provider? Tell your healthcare provider about all of the medicines you take before and during treatment with CAMZYOS, including prescription medicines, over-the-counter medicines, vitamins, or herbal supplements. Taking CAMZYOS with certain medicines or grapefruit juice may cause heart failure. Especially tell your healthcare provider if you take over-the-counter medicines, including medications like omeprazole, for example, Prilosec, esomeprazole, for example, Nexium, or cimetidine, for example, Tagamet. Tell your healthcare provider if you take other medicines to treat your obstructive HCM disease or develop an infection. Do not stop or change the dose of a medicine or start a new medicine without telling your healthcare provider. What are the serious side effects of CAMZYOS? A serious side effect is a side effect that can sometimes become life-threatening and can lead to death. CAMZYOS may cause serious side effects, including heart failure, a condition where the heart cannot pump with enough force. Get medical help right away if you experience new or worsening symptoms, including shortness of breath, chest pain, fatigue, racing heart, palpitations, leg swelling, or rapid weight gain. What are the most common side effects? The most common side effects of CAMZYOS include dizziness and fainting, syncope. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of CAMZYOS. Talk to your healthcare provider for more information about side effects. You may report side effects to the FDA at 1-800-FDA-1088. You may also report side effects to Bristol-Myers Squibb at 1-800-721-5072. How should I take CAMZYOS? Before starting treatment with CAMZYOS, your healthcare provider will do an echocardiogram, or echo, to assess your obstructive HCM. Your heart must be regularly monitored with echoes while on treatment to help your healthcare provider understand how your heart is responding to CAMZYOS. Talk to your healthcare provider for more information about echoes and your echo schedule. CAMZYOS comes in immediate release capsules containing 2.5, 5, 10, or 15 milligrams of mavacamten. Each capsule is marked with the word MAVA and the number of milligrams it contains. Inactive ingredients: cross-carbamylose sodium, hypromellose, magnesium stearate, non-bovine, mannitol, and silicon dioxide. Capsule contains black iron oxide, gelatin, red iron oxide, titanium dioxide, and yellow iron oxide. Take CAMZYOS exactly as your healthcare provider tells you. Take it once a day, by mouth. Swallow the capsule whole. Do not break, open, bite, or chew the capsule. Do not change your dose of CAMZYOS without talking to your healthcare provider first. Talk to your healthcare provider about the right dose for you. What if I miss a dose? Take it as soon as possible and take your next dose at your regularly scheduled time the next day. Do not take 2 doses on the same day to make up for a missed dose. Your healthcare provider may change your dose, temporarily stop, or permanently stop your treatment with CAMZYOS if you have certain side effects. What if I take too much CAMZYOS? Call your healthcare provider or go to the nearest hospital emergency room right away. How should I store CAMZYOS? Store CAMZYOS capsules between 68 and 77 degrees Fahrenheit, 20 to 25 degrees Celsius. Keep CAMZYOS and all medicines out of the reach of children. For more information, please see the U.S. full prescribing information, including boxed warning and medication guide for CAMZYOS. Talk to your healthcare provider for more information about this medication.